Okay, so today we are going to be doing the arm and shoulder routine, starting with the shoulder, arm, forearm, and then hand. I don't always do this routine when I'm working in a 15-minute chair massage. The only time that I will do this routine is if they have a specific complaint of their shoulder, arm, forearm, or hand, or when I ask if they have any specific things that they'd like me to work on. If they say no, no complaints, just general relaxation, then I will always include this routine. It just really depends on how much time I'm going to spend doing this routine on my client. If my client has a complaint about the right shoulder or forearm or hand, then I'll probably spend at least half of the 15 minutes on this area. Otherwise, I will probably just do a general quick 2-minute, maybe 1 minute on each side shoulder and arm routine. Just to give it that feel of completion, to give it that feel of a full body chair massage. It kind of adds just a little touch to everything so that they feel like everything got worked on. So obviously what I'm going to always do is I'm going to start with trap squeeze. I'm going to start with releasing trapezius, upper and middle, and a little bit of lower trapezius. Remember, lower and upper trapezius together are doing upward rotation of the scapula. That's where the shoulder comes up to the ear. The lateral part of the scapula, the acromion process, comes up to the ear, like holding a phone to your ear or holding a purse on your shoulder. So I'm always going to start with that, obviously, the same way that we've been doing it in my other videos. Just a very broad, flat pressure on middle and lower trapezius. Remember, lower trapezius goes down to the area of spinous process of T12, which is just above the low back. I won't have to go down there every time, but I do want to get a general relaxation feel for that muscle before I dig into the deep muscles of the shoulder. Next, I'm always going to want to release levator scapula as well. So remember, I'm trying to target the area between the superior angle of the scapula and the spine. I don't want to be directly on the superior angle of the scapula with my elbow because I don't want bone on bone occurring. Remember to keep our thumb in line with our wrist and our forearm. We want to stack the joints to displace the amount of pressure that I'm using amongst all the other joints. If I'm using the flat of my thumb, all the pressure is now at that interphalangeal joint right there. So now I'm still working on levator scapula. I'm just swooping down and pressing. Usually I'm using 2 thumbs if necessary on that superior angle, the belly of levator scapula. And then I'm going to start moving laterally. I'm going to skip over about 1 thumb width because I don't really want to push directly on top of that superior angle. It is covered by upper trapezius and I can do it lightly, but really I'm not trying to press directly on bone and smash that upper trapezius onto that bone of the scapula. So I'm going to skip 1 thumb length, move laterally, and get to the supraspinous fossa. This is deep to upper trapezius. This is the area right here on my client. So I was just pressing right here for the levator scapula attachment, skip over that superior angle, and then fall into this supraspinous fossa to adjust the supraspinatus. So now we are working into the rotator cuff muscles. So I'll be addressing it the same way that I addressed levator scapula, with a stacked thumb, preferably 2 hands helping if 1 hand is not getting in the way of the camera. And I'm just going to move laterally until I run into the acromioclavicular joint, where the clavicle or the collarbone meets the acromion process of the scapula. And you'll know where that is because it kind of forms a V right here, a little triangle, and then at the tip of that triangle is as far as I can go laterally for the supraspinatus muscle. So we can see right here, here's the clavicle, and then here's the acromion process. I'm gonna be right here as far laterally as I can go. And you'll feel the clavicle and acromion process of the scapula when you get over there. I'm just gonna be holding and maintaining that slow and steady pressure. Remember that this does a slight abduction of the glenohumeral joint. So this muscle is typically tight on most clients, especially clients that sit at computers all day. After I've worked that muscle thoroughly, I'm gonna continue with the rotator cuff and come down to infraspinatus. So infraspinatus is just below or inferior to supraspinatus, hence the name. Easiest way to find it, spine of the scapula on your client. Find the spine of the scapula and go infra or inferior to find the infraspinatus and the infraspinous fossa. So basically now what I'm gonna be doing is I'm gonna be tracking this area, this triangular area, with my thumb. I can also use a palm if it's really tender or tight on my client. This muscle does lateral rotation, so clients that have to use their mouse all day fatigue this muscle fairly quickly. And remember, this muscle has trigger points that refer down into the hand, wrist, and forearm, and it can mimic carpal tunnel symptoms. Not exactly mimic carpal tunnel, but a lot of clients have a trigger point in this area, and they'll feel pain or tingling in their hand, and they'll think and assume that that is carpal tunnel because of what their job is, repetitive typing or moving up the mouse. And the doctor just says that that's carpal tunnel without doing any tests. So now I'm just following this triangular area with static pressure. I usually don't use too specific with my thumb because it's really tender on some people, but I'm just gonna kind of hang out in here and try to find any particular area that feels overly tight. After that, I'm gonna get to infraspinatus's best friend, which is teres minor. So teres minor is gonna be on the lateral border of the scapula, superior 1/2. So I already know where the infraspinous fossa is, so now I'm just going to fall more laterally off of that and get to the lateral border of the scapula. So right here, and I need to be aware of clients that have a lot of breast tissue because it might be pushing outwards with their chest being pressed into the sternum pad. So as you're working this area, just be mindful of that to not go too far anteriorly to press into breast tissue. I'm gonna work down a little inferiorly to get to teres major as well. I'm gonna avoid teres major's best friend right now, latissimus dorsi, because we're gonna kind of work with that in the low back routine when we do that later. But for now, I'm just going to get teres major, which is the inferior 1/2 of the lateral border of the scapula, and teres minor at the superior 1/2 of the lateral border of the scapula. That's essentially it for the rotator cuff. I can't really get to supraspinatus in a massage chair. It would be a little too uncomfortable and I'd be working in just kind of an odd angle with my body mechanics. So if I suspect something's wrong with subscapularis, I would have my client get on my table. I would refer them to table work. So now I'm going to continue down the shoulder and arm, starting with deltoid, because deltoid is the most superficial muscle of the glenohumeral or shoulder joint. So remember, deltoid comes in the inferior lateral 1/3 of the clavicle, inferior acromion process, and inferior spine of the scapula, and all meets up with the deltoid tuberosity down here. So really what I'm gonna do is just a nice gentle petrissage. I'm not really trying to spend too much time with deltoid. Anterior deltoid is usually gonna be tender on your clients, mostly because there's a lot of tendons deep to that. Coracobrachialis, Pectoralis Major, biceps, triceps on the posterior side, supra, infra, teres minor, teres major, latissimus, where you have a ton of muscle attachments that are deep to deltoid. So I want to pull and lift deltoid up off of the shoulder so that I know I'm really just targeting the deltoid muscle. Sometimes the anterior deltoid, like I was saying, is a little tender because most clients spend most of their day with their shoulder flexed and somewhat medially rotated, which is 2 of anterior deltoid's actions. So be gentle when you're in that area. A lot of people don't think that you can work pec major in a massage chair. You can, you just have to be somewhat mindful of a female client and where their breast tissue is going to be. So a way for me to work pec major is I'm going to drop this arm off of the armrest, and then I'm going to support with my inferior hand, my hand that's down towards the seat of the chair. I'm going to take that, or I guess my medial hand, my hand that's closer to the inside of the client as well, and I'm going to kind of pull back on my client's shoulder, extend the shoulder joint like this in order to pull it a little bit off of the sternum pad. And then in order to protect my client and not feel like I'm getting too close to breast tissue, what I'm going to do is I'm going to find the clavicle, and I'm going to go just inferior to the clavicle with a couple of my fingers. And then I'm just going to press directly down into the ribs. So I can start medially and move laterally. And really all that I'm trying to feel for is just general tension in pec major. Sometimes I can kind of move the shoulder a little bit to get a little bit of movement in pec major as I'm compressing it, do sort of like a pin and stretch. And as I move laterally, I will find somewhere in there the coracoid process. The coracoid process is the attachment site for pec minor. Basically what you do is you find the acromioclavicular joint and you just go inferior-medial to that. So inferior and medial. And in this general area is the coracoid process. Pec minor is one of the more prominent muscles that pulls the scapula anteriorly, or abducts the scapula. So it's a huge postural muscle that causes forward shoulder rotation. So it's definitely a muscle that we want to work on. As I bring my client's arm back up, one of the things about biceps and triceps in a massage chair is that it's not a great angle for me to be able to use my body weight to apply pressure, because it's kind of just sitting here. I don't have a armrest here. I don't have a sternum pad here in order to press on. So I don't spend too much time on biceps and triceps. Really all I'm going to be doing is a transition move. I'm going to be using my thenar eminences on both sides to grab and compress biceps and triceps simultaneously. Now keep your finger pads straight here. Do not curl your fingers. If you curl your fingers, you're going to get into this brachial plexus right here, which is a bunch of nerves, arteries, and veins, not covered up by any muscles. So I want to keep my fingers flat as I do this move and just kind of spread fascially with my thenar eminences of both of my thumbs, the pads of my thumbs. And really remember, this is just sort of a transition move to get myself down into the forearm. So with the forearm, there's really three things that I'm trying to work on with my client. I want to work the extensors at the lateral epicondyle. I want to work brachioradialis, and I want to work the flexors at the medial epicondyle, which we can't really see where we're at in this video. Just know that it's on the anterior side of the forearm is where our finger and wrist flexors are. Extensors are the easiest ones to get to. I can do a broad flat compression here, but I want to be aware that the armrest itself is really only slated to handle maybe 25 to 30 pounds of pressure, not a lot. And so if my client has really heavy forearms and I'm using a lot of heavy pressure, I might break the lock on my armrest. So I need to be aware of that. And sometimes I will kind of lift my client's arm off and use just thumb compressions on the extensors themselves. Remember that the extensor muscle bellies are really only in the proximal 1/2 of the forearm. So if my client needs to have their extensors worked, I don't need to be working it all the way down here on the tendons, because the tendons are avascular and I'm not going to get a huge amount of blood supply brought back to them. So working here, I can do cross fiber friction up and down. I can do same direction friction. I can do circular friction. If it's really hot outside and it's really sweaty, I can actually probably do glides. I know that's kind of gross, but that is something that I've done before. With the brachioradialis is essentially the divider between the extensors and the forearm flexors. So with that, I'm really just going to lift it up. It's really just along the radial ridge of the forearm. So it starts at the supracondylar ridge, the lateral epicondyle, comes all the way down to the styloid process of the radius. And with that, I'm just going to lift it up. And remember, it's basically the same thing as the extensors and the flexors. Muscle belly is going to end about halfway down the forearm. So I don't need to massage the distal one half of the forearm on the radial side. That's not going to do anything. I just want to work on the muscle belly up here. Just lift and compress it. Now the difficult part with working the flexors, moving on, is that sometimes most clients spend their days pronated, typing on a computer, driving in a car. Sometimes it's hard to supinate your client's forearm in order to reach the flexors on the inside. So sometimes I'll only be able to get to around here, in which case I'm just going to have to make it work. I'm just going to take my thumb and then come down on the medial epicondyle, which over here is a better view of it. So sometimes this is less accessible. I can only get to around here, in which case just do your best with your thumb pressure. We can do the same thing. We can do that cross fiber friction. We can do circular friction, or we can do same direction. Also, same thing as the extensors and brachioradialis, I only need to work the proximal one half of these forearm and finger flexors, because that's where all the muscle belly is. Now, if I want to get to the digitorum flexors, flexor digitorum superficialis and flexor digitorum profundus, which are the muscles that go through, the tendons that go through the actual carpal tunnel, I want to get right directly onto the ulna. I don't want to press through the wrist flexors to get there. So how am I going to do that? I'm going to find the ulna, and then I'm going to wrap my thumb around and under it, and then press directly down on top of it. So you can see up here, this belly of the muscle, these are the wrist flexors that are superficial to the digitorum flexors. So I'm going to wrap around and press directly down on the ulna itself. And then when I get into the hand, I'm going to have to change my view just a little bit. When I get to the hand, really all I'm going to do is a hand massage that feels good. Most of what is controlling the hand and the fingers is going to be the extensors and the flexors in the forearm. There are little intrinsic muscles of the hand too that sort of help with movement of the fingers and whatnot, but really the meat of the action that's happening in the fingers and the wrist is up here in the forearm. So when I'm working on the hand, I'm usually just trying to do something that feels good. A lot of what I'll do is I'll take my fingers, my index fingers, and I'll do sort of like a windshield wiper motion on their hypo and thenar eminences, just rotating back and forth between one and the other. I'll do a nice dorsal fascial spread on the dorsum of the hand. I can work between the metacarpals with specific thumb pressure. Something else that always feels good too is finger traction. I'm not one of those therapists that likes to do the popping thing, because that really does nothing except make your client think that you're popping their fingers, which, okay, cool, placebo effect, I guess. But it really is useless. It's just pomp and circumstance. It's unnecessary. With the thumb is the only saddle joint in the body. We don't want to pull on that. We don't want to pull a rider off of its saddle, right? So don't traction it like you did the digits 2 through 5. Instead, just do circular motions and just do gentle squeezes on the thumb, on the sides, and on the anterior and posterior parts. And then the last one, Carl's favorite move, the guy who taught me chair massage. It's called the killer hand move. This one is really tricky. I don't expect you all to be able to get this one right away. What you're going to be doing with the killer hand move is I'm going to be using both of my hands, this hand on the inside of my client, my medial side, my medial hand. I'm going to go underneath. I'm going to take my pinky, go underneath or on top of her ring and pinky finger, underneath her middle finger. So it's on top of the ring and pinky finger, and then these other three fingers, my other three digits up here, are going to go on the posterior side of her hand. So only my thumb's on top. Now this side, I'm going to do the same thing with the index finger. I'm going to go on top of the index finger and go under the ring finger, or the middle finger. And then I'm going to take my index finger and bring her thumb back. So now it's just her middle finger that's sticking up, or as Carl would call it, their 285 driving finger. And then I'm going to use my thumbs to spread open the palmar fascia. Sometimes I don't even need to use my thumbs. I can just spread it open this way. A lot of clients that spend their day with their hand on their mouse or typing on a keyboard or driving in a car, they spend their day with their hands like this, bundled up. So this is just doing the opposite of that. It's spreading the palmar fascia and opening up the hand. Feels really, really good. I don't spend too much time on the hand. Even if my client's complaint is something something that deals with the hand, a lot of times that complaint is coming from the forearm or from the rotator cuff itself. So I don't really need to dig too much into the hand specifically. Now, if I wanted to do this more quickly, let's say that I don't have as much time in a 15-minute chair massage, which is 14 minutes. Let's say I only have 2 minutes left. Well, in order, I've already released all of this stuff on my client. So really all I have to do is do a little bit of extra supraspinatus work, which I can do up here. With supraspinatus, I do like to face the opposite way so that I can put my weight into it, right? Stack my joints and then fall into it. And then just do a little bit of infraspinatus work. And then just do a little bit of pectoralis on deltoid. And then just do my transition move on biceps and triceps. And then I'm going to come up here and I'm going to use my fingers and my thumb to simultaneously grab the entire forearm. So I'm massaging the flexors on the anterior forearm and the extensors on the posterior forearm simultaneously, as well as grasping brachioradialis between them. And then I'm going to come down here and do a little bit of hand stuff. Traction, traction, everything. Minus the thumb. We just do gentle squeezes. And then I'll transition to this side since I'm already here. Work my way back up. Circle, 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 circle on the forearm. I'm not trying to really release anything or fix anything when I'm doing this quick. Just trying to give the client the feel that I've worked the entire full body that I can access in a massage chair. So that's it for and now obviously I left out the pecs and the quick and dirty because I don't really want to. Carl calls it the quick and dirty, so that's why I just called it that. Because you're just doing the quick and painless sort of overall brush of the shoulder and forearm and hand, just to kind of, like I said, give it that full feel. I didn't work pecs because I don't want to spend the time dropping my client's arm off and pulling it up this way. Especially pecs are usually tight, so I would have to spend a lot of extra time there. I'm not trying to really dig in and release muscles when I'm doing it quick like that. I'm just trying to give them that feel of completion. So that's it for the shoulder and forearm and hand routine. Next week, we're going to do a little bit of the low back. And that'll be the entirety of the chair routine. Thanks, y'all.